Hi, I'm Chamila Chandani, and welcome to my presentation on lung cancer risk and survival insights. This project used Tableau visualization to explore how lifestyle, environmental, and healthcare access factors influence cancer outcomes. The goal is to uncover meaningful pattern and propose evidence based on recommendation that can inform public health strategies. Lung cancer is one of the deadliest cancer in worldwide. It's often diagnosed at the late stage, mainly due to poor access to healthcare. In this study, I used the lung cancer risk and prediction database from Kaggle to investigate what truly drives the risk and survival outcome. The focus is not just to clinical factors like smoking, but also structural issues like where someone lives and what care they can access. This study is guided by three sub-research questions, which is based on the main one. First, how do smoking status and environment exposure affect risk across age group? The second one is what role do socio-economic status and healthcare access play in survival? And the third research question is how does access to the screening and treatment influence mortality outcome, particularly between urban and rural population? Each of these questions is explored using Tableau dashboards built on real patient level data, which is taken from Kaggle. Distributed across the world. You can see in different countries how many sample has been taken for this database. For example, in Russia, 15,175. Likewise, from different countries, there are sample has been collected and all that being used in this database. Let's review dashboard 1 at first. This bar chart, I compared smoking group, smoker, non-smoker, and former smokers. Each bar represents the percentage predicted to develop lung cancer. Surprisingly, all groups chose similar prediction rate, around 6 to 7%, visualized with color code bar for clarity. This stack bar chart in Tableau shows combination of second-hand smoke and air pollution level. Despite expectation, the bars shows even distributed prediction across most groups, indicating that these environment factors do not greatly impact on predicted risk. This chart tracks mortality risk across age basket for each smoking group. Trend line stay nearly flat, demonstrating that age and the smoking have only a little influence on predicted mortality. This clustered bar chart compares prediction by age group and smoking status. Tableau's filtration help isolation trends showing consistently similar percentage across all combinations. With all this insight of dashboard 1, Tableau clearly showed the lifestyle variable along doesn't shift risk significantly. This support the need of multifactorial prediction models. Now let's go to dashboard 2. Dashboard 2 uses in Tableau to illustrate how social and healthcare related inequities affect the stage of lung cancer diagnosis. This group bar chart in Tableau is breakdown diagnosis stage by socio-economic status. The visual shows taller bars for late stage diagnosis, which are stage 3 and 4. In low and medium income groups, making disparities highly visible. Here in this chart, Tableau visualizes the proportion of patients by stage and access level. Bars for poor access are concentrated in stage 3 and 4, while good access is linked to earlier stages, clearly revealing through stacks visual layers. The dashboard 2 highlight the Diagnosis stage is closely tied to healthcare access as well as socio-economic status. The visual comparison make this inequity immediately visible. Now let's go to dashboard 3. It uses to show how treatment access impact survival outcome across age, mutation type and cancer type. This box plot chart compares the distribution of survival probability by mutation type. Wider box range in ALK and EGFR types indicate greater variability, but medians stay consistent. This group bar chart displays how survival varies for NSCLC and HCLC patients based on treatment access. Bars for patients with no access are significantly lower. That makes the disparity clear. This phased bar chart segments survival by age group and the treatment level. Although the view is split into the panes, consistent survival patterns are visible. Patients without treatment always show the poorest outcome. Tableau's interactive visuals made it easy to compare visual across demographics and treatment level. These visuals confirm that the treatment access is most influential survival factor. Here are few recommendations based on the data insight we have visualized using Tableau. We are recommending mobile screening for rural, low social economic status group as late stage diagnoses are more common in underserved population. Mobile units can improve early detection in these areas as seen in dashboard 2. Then subsidized treatment access also recommended. This is due to based on dashboard 3 showed that the patients without treatment access had a lower survival rates. Financial support could help close this survival gap. Next recommendation is use of multivariable prediction model. Since smoking and age alone didn't strongly predict outcome based on the dashboard 1, a broader model is needed to better target high risk individuals. To summarize, lifestyle factors like smoking or age aren't enough to predict lung cancer risk. That's clear based on the dashboard 1, sub research question 1. Based on the dashboard 2, showed that socio-economic status and healthcare access heavily influence diagnosis stages. Most importantly, dashboard 3 confirmed that the treatment access is the strongest factor driving survival. Ultimately, improving equity in access, earlier screening, and predictive modeling can save life.